I was diagnosed with RA about 14 years ago. And almost immediately after being diagnosed with RA, I was also diagnosed with systemic lupus and Sjogren syndrome. What that meant for me as a practical patient or trying to manage all of these new realities in my life was that I was keeping track of a lot of information. The first few months were fairly chaotic, but I began to realize that with monthly physician visits and a lot of trial and error with my medications, and there were a lot of them, a dozen of them, and monthly lab tests, I was generating a lot of paper, and the paper had a lot of different values on them. And the only way I could make sense of it was to try to keep paper logs and paper lists, and finally I graduated to Excel spreadsheets, especially for the drugs, because things kept changing around. So I was trying to make a logical narrative to share with my physician every time I was in front of her and to make sense. And it also was a great comfort to me as a patient to say, well, I did this with this drug and that resulted in less or more pain, less or more mobility. But I was trying to build a story. And that is the big thing for patients with serious chronic diseases, that you have to keep track of a lot of different things to tell your physician a reliable story, to be a good reporter of your own disease.